Hello. I'm here
Hello.
with Dr. Elizabeth Dawson-Hahn, pediatrician at Harborview Medical Center. Welcome, Dr. Dawson-Hahn.
Hi, thanks for having me.
Thanks for coming. We're here to talk about telehealth and some issues around language access. I'm the program coordinator for the Refugee Elders program at Refugees Northwest. So I'm particularly interested in issues that affect refugee elders who have limited English. Can we start off with telehealth? Can you tell us what telehealth is and why we're doing it right now?
Sure. So telehealth is like a big overarching term, I think, that generally means that you're meeting with your doctor or a mental health provider or maybe another professional over something that is not in person. So my experience in our clinic is that it's usually over a video conference similar to this call. So maybe it's over Zoom or some other way we get to see each other's faces with a camera. Some people call telehealth telephone visits where you can't see each other, but most people think of telehealth as being a way to connect with your provider when you get to be in your home and the provider gets to be in the clinic. And you can see each other, but you don't get to do a physical exam in the same way that we typically think of a healthcare visit.
Okay, that makes sense. And why is it important right now?
Yeah, good question. Right now, it's important because we're in the COVID-19 pandemic and we're trying to limit the potential points of contact where people might be at risk for infection. And I think this is particularly important for people with complex medical conditions that might put them at higher risk of being affected by this virus. And relevant to the people that you get to work with, elders are particularly vulnerable to this virus. And so it makes a lot of sense to me why my colleagues who take care of elders would want to connect with people over telehealth so that they don't have to bring them into the hospital, which could put them at risk for infection.
Yeah, I work with folks who are 60 years of age and older, and I have heard this is a high risk category. So maybe more telephone and video conferencing visits could reduce some of that risk.
Yeah, I think
Um,
that that's true.
let's talk about language access. I know you know a lot about this subject because you have many patients who have limited English or no English. So what kind of help is out there? What kind of help exists for people who don't speak English well enough to describe their medical conditions or who don't speak English at all?
Yeah, this is something I experience a lot. I would say about 75% of the patients I take care of in our clinic prefer to speak a language other than English in our healthcare settings. And so we often use interpreters. And in fact, often I consider interpreters to be more important to the healthcare visit than myself because
Hmm.
they're really the information connection with the patient. And interpretation can look really different. So sometimes we're able to have an in-person interpreter, and so that means a third person in the room or a fourth person in the room with the patient and their parent in a pediatric visit. Sometimes it's actually over the phone, and sometimes it's actually another version of telehealth where we have an interpreter on a video screen and a patient in the room, and we're all trying to connect to provide care to the patient. I think a super important thing to remind everyone is that everyone has a right to interpretation, that it's a legal right that you have to have an interpreter. And so you should always feel like you can ask for one, even if that feels uncomfortable. It is always the right of the patient to have an interpreter.
That does sound important to know it's your legal right to get interpretation to be able to describe what you're going through in your native language. So a patient in a doctor's visit sometimes talks about really sensitive or personal stuff. I'm wondering how does this work with an interpreter? Because this is a stranger in the room.
Yeah, that's a really good question. So any individual who does interpretation within a hospital system, so any interpreter, whether they're on the telephone or what we call the language line, or they're in person, has a code of ethics, and their code of ethics means that they can't share the information that they're helping communicate in the doctor's office. I've sometimes had families share with me that when there's an in-person interpreter, that might be more comfortable to them because they can see who the person is, or it might be less comfortable to them because potentially they recognize them as being a member of their community. And even though they know that they can't share what is told to the provider in that visit, it still feels uncomfortable to them. And so I think something that's really important to know is that if you felt like you wanted someone over the phone who might be in another city or state so that they weren't connected at all to your community, you always have the right to do that. So you could be seeing a doctor and there's an in-person interpreter, and you could say, you know, I would actually prefer that we switch to using the telephone. And I think I sometimes have done that with families where they've said, it would make me a lot more comfortable if the person that I was communicating with were not here present in the room. And so I think that's important to know.
That's really interesting. Can a patient express a preference for a male or female interpreter if they're talking about something they just don't feel comfortable talking about with let's say a man is talking about men's health issues, doesn't want to have a female interpreter? Is that a preference they can express?
Yes, that's definitely a preference that you can express. And in fact, as you become potentially have more and more experiences with a healthcare system, you can actually schedule an interpreter at the same time you schedule your visit, and you can ask for that, like a male or female interpreter at the time of the visit. But let's say you get to the visit and the interpreter on the phone is a man and you'd prefer a woman, then you just have to let your provider know, and they will happily hang up the phone and call back the language line and request an interpreter in whichever gender you prefer. I think every once in a while, very, very rarely, if you speak a language that is a less commonly spoken language, they might have a harder time finding someone. But even in that case, it's still your right to ask to reschedule your visit until they have an interpreter of your gender. That is always within your legal rights and your rights as a patient.
So it sounds like the patient has a lot of rights, but needs to know about these things to be able to advocate for themselves.
Absolutely.
A last thing I wanted to ask about is a lot of times, like with the clients I have, they have younger family members or friends who speak English better than they do. And it seems like it would be very tempting to just say, why don't I bring this family member or friend to interpret for me during a medical visit? Do you have any thoughts about that?
Yeah, that's a really good question. This comes up a lot in our visits, and I would say that technically, by the requirements of the hospital system, or usually the clinic where you work, the provider actually can't use your family member. And it's not because they don't think your family member speaks fantastic English or knows you well, but there's a concern that it puts an additional expectation on them, and we don't have any way of evaluating their health language ability. And in a way, I think healthcare is its own language. In addition to English, we're speaking English and we're speaking healthcare language. And we don't have any way of knowing whether or not family members have expertise in the healthcare language. And so it's our responsibility as a healthcare system to utilize a professional interpreter. But we always invite family members to come. And in some situations, we're happy if, let's say, the interpreter communicates something between the patient and the provider and the family member wants to clarify, they're always invited to do so. And I would always encourage you, if you have a family member who wants to be involved in your healthcare, they are welcome and they should feel free to come. But it is unlikely that the health system will allow you to use them as the interpreter. And really, it's all about protecting you and making sure you're getting the information that you have the right to have.
That makes a lot of sense. I mean, healthcare language, I am a native speaker of English, and healthcare language gets very complex very quickly. So having a trained and confidential interpreter there, it just makes perfect sense. It's wonderful that we have that resource.
Absolutely. And I think sometimes families ask me, It would make it easier for you if my family member just communicated my needs, and then I don't need to communicate my needs through an interpreter. But our goal is to take care of you as the patient. And so we want to communicate with you. And this comes up a lot in visits where children sometimes have learned English faster than their parents as a pediatrician. And I still, even if the child is speaking English fluently to me, will get an interpreter so the parent can be a part of the visit, because we consider all the family members present in the room to be team members in the care of the patient. And so it's so important that they also get to communicate with the provider. And so that interpreter might be important in that situation as well.
That makes sense. Well, thank you, Dr. Dawson-Hahn. This has been really interesting. We're learning about telehealth and learning about language access. And I know that the elders in the program that I run are going to be very interested in hearing all of these things. So thank you very much for sharing your expertise.
You're welcome.